My name is Michael Grote, and I am a clinical psychologist here in the city of Houston. I currently have a practice that works with adults and adolescents. I treat a range of conditions from anxiety to depression, interpersonal difficulties, stress-related difficulties, and both individual and group formats.
My name is Irvin Tantuco. I practice sleep medicine in the Texas Medical Center. I've been in private practice for the past 5 years. I did my residency training in Philadelphia, went on to fellowship training in sleep medicine, and I'm board certified in sleep medicine. I've been treating sleep patients for the past 5 years.
I'm Dr. Sherman Yu. I'm a bariatric surgeon with Texas Laparoscopic Consultants. My specialty is with weight loss surgery.
My name is Derek LaHare. I work for Mattress Firm, and I'm a program development manager inside of our learning and development department, which means that I get to help develop a lot of the educational content for our brand new associates. Exercise will certainly affect your quality of sleep. One of the things that we know about sleep is that extra weight on the body can promote things like sleep apnea or even more pressure points throughout the night. And anytime you have those two things, or even in conjunction, it can certainly prevent you from getting the best night's sleep possible. So as much exercise as you can possibly manage, we recommend that for helping you sleep better.
Any type of exercise can help promote positive sleeping habits, as long as you wait the recommended 5 to 6 hours after exercising to sleep. Some lighter exercises such as yoga and light stretching tend to help people sleep better, even if you do it right before you're ready to go to bed. The difference between heavy kind of physical cardio exercise or weight training versus light stretching and yoga is that in light stretching and yoga, you're not really raising your body's core temperature as much. You're actually more doing a relaxation type of exercises.
Exercising does promote better quality of sleep. If one exercises on a regular basis, their overall sleep architecture improves. They have longer hours of deep sleep, they get more of the restorative sleep, which is very refreshing to them.
As we face stressful situations, our body has normal physiological responses in relationship to stress. Our bodies emit cortisol. We also emit epinephrine or adrenaline. And so the exercise helps reduce the amount of stress hormones in our body. And that kind of activity level can kind of burn off the residue of stress from the day and set us up to go into the evening in a manner that facilitates our probability of getting to sleep and sleeping well.
Foods that people should avoid before going to bed are foods that are high in fat or acidic foods that could cause acid reflux or heartburn, aka indigestion. Anytime that happens, you're not going to sleep well throughout the night. Also, foods or even beverages that are laced with caffeine will have the same effect. They'll keep the brain engaged and you won't get a restful night's sleep at all.
Foods that people should avoid before sleeping are foods that are basically stimulants. Caffeine is really the key one to avoid. Really also heavy protein types of meals are bad for someone before they sleep. This all tends to interrupt the sleep cycle.
There are a few mental or meditation activities that can promote better quality of sleep. One of them can be just watching your breath go in and out for 2 to 3 minutes before you go to bed to help your mind relax and wind down throughout the day. That way you're not thinking about the events of the day, but you're focused on the here and now, and that's sleep. Also, listening to some soothing music or even sounds like a white noise machine helps block out ambient noise and prepare your mind and body for sleep as well.
I've seen people engage in exercises of gratitude. So in the face of the day and the stressors and the worries, pause for a moment and think about what I'm grateful for, what I'm happy about in my life. That can relieve stress.
We are often told that diet and exercise are imperative to one's overall health and well-being. I would like to add that diet, health, and a good night's sleep is important for you to stay healthy.
So I think that the foundation of really good, effective day-to-day problem solving and managing life stresses really begins with sleep. And that sleep is, as I think of it, and as I think of it with people I work with, that some of the physical foundational pieces really need to be in place. Sleep, some basic exercise, good appetite, or good nutrition. Those building blocks, I think, are what life needs to be grounded in. and without that we potentially compromise our full effectiveness.